Hello everyone, this is Dr. Akanksha. I am a 6 months trainee under Dr. Adi Narayan Maka.
Hello to everyone. My name is Dr. Apar Mathur. I am MD Radio Diagnosis from Kaman Hospital, Air Force, Bangalore, and currently a fellow in fetal medicine at Adi Advanced Fetal Care with Dr. Adi Narayan.
Hi, this is Dr. Divya, radiologist from Andhra Pradesh. I have joined Dr. Adi Fetal Care for fetal medicine training.
Hello everyone, I'm Dr. Divya Pandey from Bhopal. I'm a radiologist and currently a 6 months trainee under Dr. Adi Narayan at Adi's Advanced Center for Fetal Care, Bangalore.
Hello everyone, my name is Manisha Kala.
Hi, I'm Dr. Praniti and I've been in Adi Sir's fetal medicine class for over 3 months now.
Hi everyone, I am Dr. Prakriti. I'm a radiologist.
Hello everyone, I am Dr. Priyanka Das. I am a trainee under our esteemed Dr. Adi Narayan Maka at Adi Advanced Center for Fetal Care.
Hi, I'm Dr. Rajagi Reddy, a consultant obstetrician gynecologist practicing at Raichur, Karnataka. I'm blessed and fortunate to be a fellow under learning fetal medicine under dearest Adi sir. I'm from batch of October 2021. It's been almost 5 months of spectacular training that I'm cherishing till date and still to go.
Hi, I'm Dr. Sushma, gynecologist from Telangana.
Hi, myself Dr. Sonam Verma. I have done my PG in MD Radio Diagnosis from Indore.
Hello everyone, I'm Dr. Ruchi Bajwa, one of the students at Adi Fetal Medicine Center, Bangalore.
I'm Dr. Suguna, practicing radiologist for past 25 years. I would rate my learning experience with Dr. Adi as exceptionally good.
Good morning, this is Dr. Shramana and I am from Bangalore. I have completed my residency in DNB Radio Diagnosis.
Hello everyone, my name is Dr. Suvarna. I am a radiologist from Maharashtra.
Hello everyone, I am Dr. Pooja Varvatte. I am a radiologist.
Hi everyone, I am Dr. Vijay Meenakshi. I am a gynecologist. I am pursuing my fetal medicine fellowship under Dr. Adi sir. I have finished almost 3 to 4 months of my course now, and I am so glad that I got to know about this fellowship. And the first thing that many people asked me when I joined this fellowship is that, are you doing a 6 months fellowship of fetal medicine? Is that enough? Will your training be enough? Will you have to do anything extra to supplement it? Well, 6 months course is definitely enough because the experience under sir is really fascinating. That he holds the probe and he teaches you. I don't think anywhere else in India they do that, and his passion for teaching is really great. The hands-on and the confidence that we get here is far excellent, and I also enjoy the academic discussions that we have with sir every day.
So when we come here in Adi Fetal Care, we are taught from the very basic zero level. It doesn't matter if you're a radiologist or a gynecologist, we are taught from zero level, and a very strong basic foundation is made, after which we can improve in our life.
Adi sir has completely not just changed my thought process towards fetal medicine, but also my thought process towards life. One thing that I also want to add is that before coming to Adi sir's fellowship, I'm just a weekend fellow. I just come for 1 day from Jaipur to be with sir and just see how he works. Before coming here, I did not know what 3D or 4D looked like. And it's just been 4 months that I have been with sir and back in Jaipur. Now I do 3D, 4D scans. And this transformation came only in 4 months.
And we all have a particular, this very funny joke we talk about all the time, that as soon as the sir sits on the chair and he holds the probe, the fetus comes in most favorable position. So there is a magic in his hand, his expertise, the experience he has acquired with these so many years. So we are all blessed to be trained under him during teaching sessions. So I thought of applying, and luckily I got selected for the fellowship. Before coming here, we had many fears in fetal, no doubt. The biggest fear was cardia. never looked at cardia beyond 4 chamber, and that too without much expertise. So, but now when we look at Sir while he scans, we observe him, and the way he solves the deepest mysteries of cardia within seconds, we simply get spellbound.
Board, but I'm going to tell you two favorite things of mine about him. One would be that the minute you enter his class, you can be a practicing radiologist, an obstetrician, someone who's just given their exam recently. But the minute you enter his classroom, you're all at par, not only with each other, but even with him. Because he truly believes that if he can do it, so can his students. I mean, we've all practiced medicine for quite some time, so we have met amazing clinicians and doctors over the time, but to know is one, to teach is another. And Adi sir is truly...
And then how to get the required sections, and also how to go about the cardiac evaluation. So I never thought I would be able to diagnose any pathologies in the cardiac examinations, but we are able to do that now, so it's giving me a lot of confidence. Also, another eye-opener for me has been the usage of TDS in high BMI patients. So that gives us a very good window to visualize a lot of things. Adi sir's classes are just amazing. We have a lot of fun while the teaching program is going on. He makes it all very fun to understand, and he makes it very simple. It's like just getting the notes of 1,000 pages book.
I joined this fellowship for fetal medicine in October 2021, and I really find myself fortunate enough to be chosen by our Adi sir to get myself trained in this field. When I joined this center, I still remember my first day when I was quite apprehensive in front of my fellow partners who were from the field of radiology and gynecologist, having some hands-on in the field of scanning. I, being a gynecologist with no prior exposure in the field of ultrasound and scans, was really very fearful. But I still remembered few words of our Adi sir, which really boosted me from the very first day. He said that it is always better to paint in a blank piece of paper. And when I am today half into the course and I assess myself, I really find that our Adi sir is a craftsman who never turns a stone unturned to bring the best out of ourselves.
I have been working in Adi fetal care from the last 4 months, and my graph in antenatal scan has risen exponentially. Earlier, before coming here, I was doing some basic antenatal scans, and I thought that I'll be at some level and I'll be improving from that. But after coming here, I realized that actually I was at a minus level because all the things which I was doing was not correct at all.
Other than the imaging and intervention part, the one most particular thing I observed and I learned with Sir is I never thought that the patient counseling can be taken to such so high up levels. After scanning, the patient is be seated in a particular counseling room, and Sir will come and explain everything so calmly. He'll explain every single detail. He'll illustrate with diagrams. He'll explain about the management, further investigations. The patient leaves the room with so much full-heartedness, and it's so rare to see these days. So I feel myself very much blessed to be trained under him, to witness his passion for fetal medicine, to see his enthusiasm for teaching and his compassion for patients. Thank you so much.
About Adi sir is a born teacher. He's so passionate about teaching that really has set him apart in my life as an exemplary teacher that I have ever had. The training program is so well organized, and it is so meticulous that we are exposed to. About the theory classes that we have are just extraordinary. Sir has encouraged every candidate to take up presentations.
I have been practicing for the last 10 years. I got my Fetal Medicine Foundation UK certification for NT and anomaly scans 5 years back. When I got to know about Adi sir through my friend, initially I was hesitant because I didn't know of how much help would it be. After I went there, every single day I gained immense knowledge from Sir. There are 4 ways of learning there. One is by theory class every week. Second is by bedside learning while doing scan. Third is by the material. Sir has a lot of material of abnormal cases that he has pulled up through all these years, which is stored in the computers. And fourth is by getting to do presentations.
And what I have learned through this program is like how to take standard biometric measurement and how to detect the early anomalies in the fetus. And it can be structural, it can be chromosomal, or it can be single gene disorder.
I had always this fear about anything above the diaphragm, especially the cardia. And one of the best things that that Sir has taught us, he's taken us through this amazing journey of the cardia, right from the anatomy to the scanning, how to do it. That it's almost taken out my fear of cardia, and now whenever I do the scan, I am so excited to look at the heart, what's going on with it, and I've almost started making some DDs about it, so I'm very grateful for that. For
in today's competitive world, Dr. Adi is ready to transfer all the information he knows without any hesitation, provided we are ready to receive all the information. Earlier, I had a lot of hesitation in doing 3D scans. Now, after joining his class, my confidence in doing 3D has tremendously improved. Also, the counseling skills with the patient, I have improved a lot after joining the class. Thank you.
Sir decided to go forward with fetoscopic laser ablation of the placental arterial anastomosis. And we prepped up the patient and we scheduled for the procedure. That procedure was a complete DNA changer for me. Going into the mother's womb and seeing the baby for the first time before delivery, the hands, the fingers, the eyes, and then searching for the arterial anastomosis in that setting, and then further ablating it with laser. I have never seen something before coming here like this.
I am a trainee at Adi Advanced Fetal Care. I had joined in October 2021 weekend batch. So when I joined the fellowship, I had very less exposure and experience in fetal ultrasound. So I am very thankful to Adi sir for giving me an opportunity to join this fellowship and improve my skills in fetal ultrasound. Adi sir is an amazing and excellent teacher. He helps us while doing the scans. He holds our hands with the probe and teaches us the purposeful movements that are needed to get the perfect images in order to diagnose the anomalies.
I have been working in Adi Fetal Care from the last 4 months, and my graph in antenatal scan has risen exponentially. Earlier, before coming here, I was doing some basic antenatal scans, and I thought that I'll be at some level and I'll be improving from that. But after coming here, I realized that actually I was at a minus level because all the things which I was doing was not correct at all.
Which is very helpful. So at the end of the day, during our hands-on, Sir discusses all the interesting cases with us in the end, and we can ask all the doubts that we have. So we get to learn a lot of things during that time. And finally, I would like to thank Adi sir for such a beautiful opportunity that he has given me.
I look forward for the Friday theory classes, and I have understood concepts like first trimester screening much better after attending Sir's classes.
And with this foundation, you can build whatever you want, and you will get to see very rare and very nice cases here. That is the very good point, I think, of working here. And Sir teaches so well, and Sir gives so much of his time in this training only, and Sir clears doubt of every student, and for him every student is like equal, and he teaches everyone so nicely. This is the best thing here. And heart is taught so nicely here that you start feeling like even an obstetrician is also started getting this.
A wonderfully gifted teacher. The lessons he teaches you in his theory class, the anecdotes he uses, the stories he tells you, every little thing will stay etched in your mind for your entire life, and there is not going to be anything that you forget because he teaches that amazingly well. The second thing would be that Adi sir is an absolute magician with the probe. His 4D rendering images are art. They're so beautiful, and if any of us get even 1/10 of the skill he has, I at least consider myself lucky. He's if I have to tell you in a nutshell, I think Adi sir has taught all of us to be kind, to be calm, especially while doing a scan, because he thinks that that's the biggest asset a fetal medicine specialist can have. Confident in your subject, in your knowledge, and to refute your contemporaries or your fellows in case there is a need. But he always asks you to be confident about everything that you're doing. And the last thing would be to counsel with a lot of compassion and care. So yeah, those would be my take-home notes and lessons for life from Adi sir.
The checklists at the center are one of the best that we have, and this really makes us sure that we have not missed anything, and that is really an important aspect that I have come across.
I have learned so much about the invasive technique like CVS amniocentesis. So,
Sir taught us how to decrease the speed of the scan, and he also taught me to mellow down, not only in the professional work but also in the personal life. I'm really grateful for this amazing opportunity that Sir gave me for procuring this fetal medicine fellowship, and I hope to emerge a much confident fetal medicine specialist. Thank you.
So, all the best, sir. Best wishes. May you train more and more lucky fellows from India.
After joining under Adi sir, I know how to take a proper fetal biometry, fetal echo, extended fetal neurosonogram, 3D, 4D, and the best part is counseling. Sir is an awesome counseling. I learned the art of counseling from sir. Here we get a lot of variety of cases, and sir also has many collected cases, literally textbook cases, which he let us go through. But something which I love about Adi sir is his teaching. He is an excellent teacher, and his classes alone are enough for you to become a fetal medicine specialist. Being a radiologist, I used to do the scans before, but I was lacking the confidence. Now I'm better than before, and the way I approach the cases is completely different. I'm really thankful to Adi sir for giving me this opportunity to learn under him. Thank you so much, sir.
Correctly. And one more thing I learned from sir is only diagnosing fetal anomaly is not enough, but proper patient counseling after the scan is also equally important. And sir's way of counseling the patients is wonderful. Another thing I would like to tell is sir's theory classes are very informative. I have learned a lot of concepts from his classes. So the overall training program here is amazing. And after going back from here, I will definitely incorporate all his teachings in my daily practice. Thank you so much, sir, for everything.
Sure. We get to know so many cases here. We see on a daily basis, we see so many abnormal cases because it's a referral center. I've seen TAPVCs, TORVs, CDP skeletal dysplasias, and so on. So many interventions. I've seen IUT, laser therapy, TTTS treatment, radiofrequency ablations, and amniocentesis on a daily basis we see here. So yeah, there's a lot to learn here and a bag full of knowledge to gain from. After each day's cases, we sit back and discuss about those cases daily. Sir teaches us everything in such a nice way that it becomes a fun experience to learn from. We are so it's easy to ask questions to him, and he will reply to even our silliest of doubts in a very positive manner. So I'm really lucky in that way to get a mentor like that now. And one of the important things that sir has taught us, which will take us a long way, is to never let a patient go without the counseling, explaining what is going on with their baby in their own language helps the patient a lot. and to come down to their level and explore the options of the management. That really calms the patient down and they feel at ease after going from the center. So that's one thing I will never forget from Sir. Thank you.
So I am very thankful to the sir for selecting me as an integral part of his training program. Because of him, I have developed so much confidence. I have earned so much skill to work it as a fetal medicine specialist. I am blessed to be here.
So, one case I would like to discuss about is in the initial days, there was a case referred for echogenic intracardiac focus. I always used to brush off that finding as the anomaly scan was normal. But sir detected unilateral absent nasal bone in that case, and when subjected to amniocentesis, it is found to be Downs positive. So from that day on, I always looked for both nasal bones. Sir has shown us how to look for both nasal bones, both on 2D and 3D. When it comes to 3D, sir is like a magician. Within 10 seconds, sir can take any plane, and I have also started learning 3Ds, and I'm sure within the next 3 months I'll be able to get there to take any plane in 3D, because sir is not only passionate about teaching, but I have come to understand that teaching is also his weakness. Yeah, sir cannot spend a day without teaching. That's why I think that is his greatest strength, and that is why he's the best. And for those of you who'd like to join Adi Sir's team, I would like to add that Sir takes people at all levels of skill, like from basic beginner who is new to handling the probe to very much experienced radiologist. So the only thing you need to have is the dedication and determination and passion to join Sir's team. Thank you.
The hands-on training is just awesome. It is so well organized. The time when we get into when the patient enters, be it the history taking, then examining the patient, then the counseling part, the reportings, and apart from that, the follow-up. It is so well organized that we really feel that we are so complete, and it has been done so meticulous and with all aspects of learning in such a beautiful platform. Sir is definitely a driving force for all of us to keep improving our performance in our day-to-day life. Each one of us are guided at times when Sir comes and helps us with his hands and help us in improvising and getting the planes proper. His encouraging words keep us so motivated that we try to do imaging much better in the next time. Suggesting that was an alloimmunization with and a fetal anemia. So I knew that Adi Sir was doing interventions, so I got in touch with Sir. I referred this patient, and you can't believe Sir called me and told, Dr. Raju, you have done a good job. You have made it possible that you have sent this patient. The baby has developed hydrops and anemia. We need to go ahead with the intrauterine transfusions. You can't believe now that the wonderful couples have a beautiful baby after 4 intrauterine transfusion settings that Sir has done. That really has driven me to get along. I never thought that Sir would call me and even help me in getting proper imagings in MCA, how to do that, peak systolic velocity and all. I'm very grateful to you, Sir. And apart from that, the 3D, 4D imaging of Sirs is just not a feast to the parents there. It is a feast for all the fellows to a beautiful imaging by Sirs in fetal medicine. He's told to show the cardia. You can't believe, I could just see heart was beating, that's it. And Sir told to stop it, and he told, what's the diagnosis? So you can't believe that it was just 3 or 4 cycles, and Sir told it is APBS. It is an everyday learning for us. I am ever grateful for that, and thank you for that such great platform of learning, Sir. I look forward to keep learning from Sir, because now I have a mentor. This really keeps apart from your online training or online courses. You should need you should need a training like this. In all aspects of fetal medicine, I will try to inculcate all that I have learned, and I'll give the best I can in giving the fetal medicine care at my place. Thank you.
Talking about our training, every day we get ample time, ample scans, and ample discussions. It is kind of a theory class and a practical class going on together. There are not many qualities in our sir, but what I find the most important interesting is that he is never bored or tired of teaching his student. Every time you approach him with the same zeal and vigor, he teaches you. At the end of the day, which is quite tiring for him, doing lots of procedures and scan, he will make it a point to sit and discuss every thoughts, every burning questions that we have.
I am at some good place because I heard of many places they have toxic environment. So environment is here is so friendly and so good that you will feel like you are at home. So I am so thankful for the Adi sir that he selected me, and I want to pursue my future in this subject only, and I will work so hard for it, and I think this is the starting only, and this will go for a long journey. Thank you so much.
And I think this is one of my best decisions. I am getting so hands-on, and the theory part is very nice and it is very informative. And now I think I am so confident in fetal scans and I can have my practice good. And thank you Adi sir, ma'am and staff for giving me this up.
And I know I'm still not there yet. Nobody can be there where Adi sir is this soon. But I just hope to reach where sir has reached. I just hope to imbibe as much as sir is giving. And hopefully someday I will, even if I'm 1/10 of what Adi sir is doing right now, I think I'll consider myself a good practicing doctor as Adi sir is. Thank you Adi sir, thank you for all what you have given me. Thank you for opening my eyes to a plethora of opportunities what we should look at, and a plethora of information that there is which you were looking and ignoring. Now look at it in a different way, and that's how sir has changed my DNA. Thank you so much Adi sir, love you.
So, all the best, sir. Best wishes. May you train more and more lucky fellows from India.